welcome to Mums at the Table. I'm Rachel.
I'm Shona.
It's good to have you with us. Now, coming up on today's show, we've got Amanda. She will be talking to Gia,
Yes.
our dietitian, so they'll be talking some good stuff
Food.
there. Yep, food there. We've got our Ask Dr. Simone. So she's sitting down with Fiona to have a chat. If you've got any questions for a GP, please send them through. You can do that on our social media. We would love to pass them on for her to answer for you.
Yeah.
And we've also got Dr. Wood, our obstetrician, having a chat to Fiona as well today.
And he's
So
probably
women's
the
health.
same. If you've got questions for him, write him, let us
Send
know.
them in. He's fantastic,
Yeah,
isn't he?
yeah.
All on women's health. So coming up today, we are talking about mental health and how we're coping during this pandemic and during this, I guess, time of isolation.
Look, I found, quite honestly, the struggle with isolation to be really hard. Gary was tested early on for COVID-19 because he's a bus driver and he thought he'd picked it up. So the 5 days of isolation with him was really hard, having somebody underneath my feet 24 hours a day, for 7 days was really hard. But also because I have suffered in the past with mental illness. So for me, I became very aware quite quickly that I was seeing some of the signs of falling back into my mental illness. So I had to really be proactive and not allow myself to go too far back into it. Yeah.
What did you do?
Look, for me, I because I'm in isolation and because I'm a vulnerable case, I just spent some time in the garden with the cats, in the sun. I just read my Bible. I just took the time to look after myself, make sure I was eating, make sure that I was sleeping and not oversleeping, getting up and doing a little bit of exercise and
Because
stuff
you can
like
get
that.
into you can get into some of those habits.
Well, too much sleep is also a sign of mental illness.
okay.
So you just have to know your signs and be really, really careful about what you're doing.
And even for people who I guess don't have a history of it, are still sort of going through some of those challenging thoughts. You know, we've lost our freedom. And when I say freedom, we can still do a lot of stuff, but it's the choice to do it when we want to and when we're ready and those things.
Yeah, you feel
so
quite...
it is hard. And I think it's always really good to remember we need to look out for other people as well. I actually think that helps us in our own mental health, is looking out for others, because everybody needs to be checked in on during this time.
Just give someone a call, knock on the door and step back 1.5 and just check on them. I'm
Send
checking
a
on
letter,
my
send a letter.
checking on my neighbours quite frequently.
Yeah, and I think just being aware, I know people keep saying we're not in the same boat, we're in the same storm, but we still need to be checking on each other in any boat that they're in, so that's something to do. So we'd love to hear from you. Let us know on our Facebook page. Tell us what you're doing to combat some of the challenging times while you're in isolation.
Hey, Dr. Simone and I are here to have a chat about bumps, cuts, concussions, all sorts of fun things that happen to your children, intentionally, sometimes intentionally, and sometimes not intentionally. But what, as a parent, can we do to, I guess, reduce the anxiety that happens with bumps, cuts, concussions, anything like that?
So invariably, if you have a child
what should we do?
and is an inquisitive child who likes going to the park and running around and playing, they're going to hurt themselves at some point in time, be that a scraped knee, be that a split chin, be that whatever.
Ooh.
And so the key thing that I think that we can do as parents is anticipate that this may happen and be prepared. So I have a really good first aid kit.
Okay.
So get set up at home with a really good first aid kit that has dressings and some disinfectant, has some bandages, has the things that you go, I wish I had that.
Right.
When you're in that situation.
Okay. So carry it around. They sell some that are just...
You can get little tiny
yes,
ones for the
travel
pram,
bags,
you can get ones for the car. Knowing that you've got that can help you to be prepared.
Yes.
If there is... So the other thing that I think is really important is that kids will feed, at the time of an injury, a child will feed off of our emotion. And so if we see blood and faint, that's not going to be a good situation.
Because it's scary for a parent.
It's scary for a parent, it's scary for a kid, absolutely.
Right.
So as much as you possibly can, try and stay calm in the moment. You can freak out later. It's perfectly fine to freak out later, but right then your kid needs you to be calm. So that's what you need to try and be as much as possible. If someone's cut themselves.
Yes.
Give it a clean. Wash it with some water. If you've got some antiseptic, use that too. But keep it clean, and then if it's an easy cut to put back together with a bandage while you're going and getting it checked out,
Yes.
wrap a bandage around it and hold it together.
Okay.
If something is bleeding, clean it, press on it.
Okay.
Some pressure with like a towel, or if you've got some, gauze bandages or something like that, will be really helpful in terms of stopping the bleeding, and blood freaks kids out as well.
Yeah.
So minimising the things that are going to distress them. If you're unfortunate enough to break a bone or something like
Bumps,
that.
so often like babies will fall,
Yep.
hit their head.
So those are the sorts of things where you need to, did they blank them? Did they black out? Did
Right.
they lose consciousness, or did they just cry straight away and then get up and get on with doing what they were doing?
When should we go to emergency or take our children to the
If your
doctors?
child has bumped their head and then they have either blacked out or vomited,
Right.
or you notice that they're losing like a little bit of fluid out of their nose or their ears, those are the things that can indicate that it has been a bit of a more serious head injury, and you need to get that seen to straight away.
Thanks so much, Dr. Simone, for those awesome tips. I hope that's helped you when it comes to bumps, cuts, concussions. Don't ever hesitate to take your child to the doctor if need be.
So today we're talking about glycemic index and how important that is for your child's health. And thank you for coming, Amanda. How are you?
Good.
And I'm very interested to hear what you have to say. What is a glycemic index?
Yeah, so the glycemic index, it rates carbohydrate containing foods based on how quickly and how much it raises your blood sugar levels.
Okay.
So I guess I should say what carbohydrate foods are. So it's things like fruit, starchy vegetables like potatoes and sweet potatoes, as well as dairy, grains and cereals and bread, as well as sugary drinks and food. So, yes.
So we've got here, this would be your low carbs, wouldn't
That's
they?
right.
Or
So this is your low glycemic index.
So sorry, carbs. Your low glycemic. Sorry,
Yeah,
that's what I meant to say.
So low glycemic index foods are digested more slowly, so you get a much slower, flatter rise in your blood sugar levels when you eat this sort of food. And then high glycemic index foods are digested so much more quickly.
Okay.
They release their sugars more quickly, and you get a really high, fast rise in blood sugar levels.
So if your child's already extremely active, like my son, you would stay away from having too much of that.
Probably not too much.
So what about this? Okay, so what are the benefits of having a low GI?
So the main benefit is really more stable blood sugar levels, which is great for anyone with diabetes to help them get a better blood sugar control. These foods also reduce your risk of developing type 2 diabetes and heart disease. They can also be useful for appetite control as well as weight management, because they help you feel fuller for longer, because they are digested more slowly and they have longer lasting energy.
And that's why my
as well.
kids, when they have something like this, they're like, I'm hungry, like 20 minutes
That's
later.
right. It doesn't last very
Has
long.
anyone got the same issue as me? My kids say, I'm hungry. But if I give them something like this, like a banana, they don't say I'm hungry straight away.
That's right, yeah.
That's really good. Okay, so should we only have low GI? Like how?
Well, it's great to include a range of low GI foods, particularly choosing ones high in fibre. But you don't need to only have these foods, and there's a couple of reasons for that. And the main one really is that not all low GI foods are good for us.
Okay.
Would you believe that chocolate has a low GI?
No!
As well as corn chips.
I would love chocolate. Okay.
And ice cream and some cakes also have a low GI.
Really?
And then foods that are really good for us, like, for example, we've got watermelon here and potato
potatoes,
and brown rice. These are good for us and they have higher GIs, but we should still include those in our diet.
Okay, so you just need to have the majority of this and then have these ones, the ones that are good for us, which
Just use it as a tool when you're considering what sort of foods to have.
Thank you so much for all that information. Please subscribe to our YouTube channel, Mums at the Table, or like us on Facebook. These are questions that you're giving us and we really appreciate it. We'll see you next time with our next question. See you then. Bye, Amanda.
Hey, I'm sitting with Dr. Wood and we're talking about pain relief options that expectant mothers can have when it's time to have a baby.
Well, it's a really important subject. There are so many options available, but let's just go through a list.
Okay.
Right? I guess the first thing to understand is that we've got to think about mum and baby.
Right.
You know, there's two people here that are going to be affected by some of your pain relief options.
Right.
In the ideal, perfect world, it would be good to have no pain relief.
Yeah.
That
And some women do.
and a lot of women
on
do.
you. Yeah.
And it's great.
Yeah.
But that isn't appropriate for all
Yes,
people. And sometimes, like if you're having a twin delivery or certain other procedures, it seems very appropriate to have some pain relief.
Right.
So,
because you could get to a stage where you need some medical intervention.
that's right. And especially with twin deliveries as such, you know, it's like...
Speaking of experience, yes.
It's likely you need to have some intervention that,
Right.
if you didn't have pain relief, might prevent you from being
And it
able to get
doesn't
done.
make you any strong of a woman or less
The
strong.
goal is to have a baby.
That's right.
It's not about how you get there. It's about the result at the end.
I think that's so important that we
Yeah.
remind our mums that.
Correct. And, you know, just because one person had a caesarean section or one person had a vaginal birth, it doesn't make no, you're all important mums and you're doing a great thing. So, during labour, what options are available for pain relief? We'll start with a lesser option and work your way up. It's really good to think about things like getting in the shower.
Right.
Something warm water on the back can really helpful. Someone's going for a walk.
Right.
And actually walking.
I did that.
And going for a walk when the contraction's there, not
Yes.
just stopping, but walking while the contraction is actually really helpful.
I was dancing in the labour room. So
There's nothing wrong with
keep
that.
Moving.
Sometimes having some cranking music in there is really
Yes.
good too. I had one person who had Metallica on in their room. It was like pretty cool.
Okay, so let's get to the good stuff.
Yeah, okay.
The meds.
Okay, so you can have nitrous gas,
Right.
and it can be dialed up to a different degree. Now, I don't recommend starting out on 100% because it really makes you sick straight away.
Right.
Start out really low dose, and you've got to take 3 or 4 big breaths in before you start noticing an effect. A lot of people use that. It's very effective, and
Is that the gas?
The gas.
I
Yeah.
love the gas. Sorry.
Yeah, nitrous.
I do.
Right. So the next...
It helped.
It does. It can help, and it kind of distracts you and
Yes,
takes
it
you
does.
somewhere else.
Yes.
And you tend to use it just when the contraction's there, and then you
Okay.
stop it when it's not there. You can have an injection of a narcotic like pethidine or morphine.
Right.
Now, so the gas, once you stop it, it's out of your system pretty quick.
Okay.
When you have morphine or pethidine, it lasts for about 3 or 4 hours.
Right.
And if you're imminently about to deliver your baby, it's probably not a good idea because that can affect your baby.
Yes.
And can make the baby a little bit sleepy. And then
Yes.
but if that happens, say for instance you have this injection and miraculously you've delivered the baby shortly afterwards,
Right.
there is medicine they can give the baby to reverse the effects of that injection should that be needed.
Right.
Very uncommon that that's the case, but again, and morphine, what does it do? It's a sedative, it's a relaxant, it's a pain reliever,
Okay.
and it can have all the effects. The negative side effects of morphine can make you vomit.
Right.
So sometimes when they give you the morphine, they may give you medication to...
Okay. Then you have the epidural. Is that right?
Epidural is the next sort of and
Level.
final place to go to.
Okay.
Right? And epidurals are brilliant.
Right.
They allow you, they basically kind of semi-anaesthetise your body.
Right.
So that you can have contractions but not actually feel the discomfort. You may still feel some pressure.
Right.
And they can be turned up and down. An epidural is basically a little tube that's inserted next to your spinal cord and medicine is infused in there very slowly, which basically numbs those nerves.
And I think it's important to have these discussions with your
Yes,
doctor
beforehand.
So talk
Yeah.
about the different options that you have when you're having the baby
Yeah.
prior to being in that room. And I think that's the way it goes.
Occasionally, as a general rule, the midwives and the support people in your birthing unit, they don't tend to offer you pain relief for a reason because you might be managing very well.
Yeah.
But if someone, then says to you, look, you're looking great, but we'd be interested in having an injection of some pain relief, it might get you to a moment of weakness and you weren't hoping to do that. So generally what happens is they wait for you, the patient, to ask.
Yeah.
You
And
know.
I think it's so important what you
Yeah.
said at the beginning, which is at the end of the day, it's about bringing on a healthy baby and you being a healthy mama. So keep it locked right here for great tips like this and so much more.
So how are you connecting with your loved ones during this time of isolation and through this pandemic when we've sort of, have been cut off in a sense from so many people we love?
Well, I'll tell you a funny story. I've been on Facebook because I've been doing some things for the church that I've been wanting to do for a while. And I've been scrolling through all these memes and bits and pieces on Facebook. And I sent one to one of my children the other day and he's like, Mum, get off Facebook. So I'm banned from Facebook now.
So that's how you're communicating or not
Well,
communicating?
no, but I just had to laugh when,
Yeah.
when they think they've got complete control of all this technology and then an old person gets on.
I know. But isn't it nice? Everyone's sort of stepping up, I guess, to the technology plate. We're all learning a lot more to keep connected, to keep in touch with each other. People are going back to the post.
Yes.
You know, sending mail.
Or even sending, you know, like email, like e-letters and
Yes.
things like that, and e-cards and...
Yeah, and a friend from our school, a mother sort of has coordinated for parents to get their kids to send letters to the aged care homes in our area.
Like pen pals.
Because they're sort of, you know, shut down. They can't have that, you know, the same sort of visitation that they've had. So it can be a really hard time, but it does force us to be a bit more creative, doesn't it, in the way we communicate.
It does.
Get out the old, you know, what is it, the tin and the
I saw
with the
that
neighbours.
on TV. Some of the neighbours were doing that. They've got the tins with the string, and I thought, I didn't think anybody knew about that anymore.
Oh, we know. We want to wish you guys a happy Mother's Day, whether you're a mum, an auntie, someone who just loves kids. We're really wishing you
a foster mum,
Yep.
somebody who's adopted children, or somebody who's just an aunt.
This is your day. Our hats are off to you.